Vagus nerve. Vagus nerve, it is a 10th cranial nerve. It supplies generally muscles of swallowing also. The type of nerve that is mixed type, that means sensory, motor and parasympathetic function also. It generally called as pneumogastric or wandering nerve. Branches of vagus nerve that are superior laryngeal, recurrent laryngeal, pharyngeal branch, cardiac branches and left recurrent laryngeal nerve. So these are the branches of vagus nerve. Generally, it is the nerve in body who has maximum branches. So superior, recurrent, pharyngeal, cardiac branch and left recurrent are the branches of vagus nerve. Vagus nerve has longest course of all cranial nerve and it extends from head to abdomen. That's why it's known as the longest course of all cranial nerve. Nucleus of vagus nerve that are dorsal motor nucleus, nucleus ambiguous, solitary nucleus and spinal trigeminal nucleus. Functions of vagus nerve: sensory, motor and parasympathetic. So first is sensory function. Sensation carries from larynx, external acoustic meatus floor, thoracic and abdominal viscera. Motor function: to the soft palate and vocal cords, it supply intrinsic muscles of larynx, palatoglossus of tongue and pharyngeal muscles. So this is the motor function. The parasympathetic function of vagus nerve, that is, it stimulate a reduction in resting heart rate. Okay, if any lesion or damage occur into the vagus nerve, so heart rate get increased. Okay, so the heart rate around 100 beats per minute. GI system, it stimulates the smooth muscle contraction and glandular secretion of organs like esophagus, intestinal tract, stomach and large colon. So these are the parasympathetic function, sensory function and motor function of vagus nerve. Now clinical part. So vagus nerve lesions causes any tumor, vascular lesions, polio, Guillain-Barré syndrome, meningitis. Meningitis, if it is chronic, then it damage your vagus nerve. Then brainstem lesions. So these are the causes for vagus nerve lesions. Clinical features: palatal weakness, pharyngeal weakness and other some clinical features is present. So first is palatal weakness. If it is unilateral, so minimal symptoms is present, but if it is bilateral, nasal speech and nasal regurgitation of fluid is occur. If pharyngeal weakness is present, if it is unilateral, so pharyngeal wall drops on affected side, and if it is bilateral, so dysphagia is present. Dysphagia, that means problem in or difficulty in swallowing. Other clinical features, that is dysphagia, loss of gag reflex, cadaveric position of vocal cord. Cadaveric means dead body like position of vocal cord. Then flattening of palatal arch, uvular deviation on normal side on phonation, and palate move asymmetrically when patients say ah. So these are the other clinical features of vagus nerve. Management done via vagotomy, vagus nerve stimulation, speech therapy and vocal cord injection.